Tak apa, janji dah buat testing semua. Nanti kan even dah buat testing pun kadang-kadang ada ni jugalah. Adalah hiccup juga Tapi tak apalah, semalam pun dah test, hari ni dah test.
Sikit-sikit tu halalan toilet.
E-learning, biasanya e-learning pun ada hiccup juga tiba-tiba hilang, muka tak nampak, slide share orang nampak, kita tak nampak. Macam-macam lah ada kan.
Video 6 minit. Okay, so saya rasa kita so far
siapa
kita
nampak partisipan, host nampak ni kan, dah nampak kan partisipan ada 21. Semualah.
62 registered, kita live. So saya rasa kita play video dulu lah.
Since 2012, we at KPJ Healthcare College has been working very hard, offering the courses that we offer, the new courses from the level of bachelor to masters, PhD, and also the medical specialist training program. We have successfully run the new
ada dengung lah
programs, and I would like to highlight that we have successfully graduated the first batch on time, and this is a testimony of the hard work and quality teaching and training of the staff, academic staff, and also the hard-working students that we have.
Tak payah play sini. Stop dulu.
Study in KPJ.
Okay, exit dulu. Dia play je, jangan play kat sini.
So?
Start kena ya. Dia start video. Okay, play ni je, jangan yang ni. Start ni. Okay, itu je. Jangan kacau yang sini.
Since 2012, we at KPJ Healthcare College has been working very hard, offering the courses that we offer, the new courses from the level of bachelor to masters, PhD, and also the medical specialist training program. We have successfully run the new healthcare bachelor programs, and I would like to highlight that we have successfully graduated the first batch on time, and this is a testimony of the hard work and quality teaching and training of the staff, academic staff, and also the hard-working students that we have.
Studying in KPJ with practices in KPJ hospitals has got me used to great facilities and technologies that shaped me to become a good physiotherapist.
Nursing has been our forte since we started the nursing school back in 1991 with the diploma in nursing. In 2014, we started our Bachelor of Nursing.
KPJUC has been here longer than my age, so I decided to pursue my dreams due to its good reputation and higher chance to get a job as soon as I graduated.
We are proud that in 2016, we have our first graduates of Masters in Nursing, which brings our nursing school to a higher level of education school for nursing. So our nursing school at KPJ UC is now an elite group of nursing school that offer all level of nursing courses.
I am proud to say that I am the product of KPJ UC that has brought me up to this level of achievement. I am serving the educations for nursing for 9 years in KPJ Healthcare University College, and I am now the principal of KPJ International College of Johor Bahru.
Once I complete my diploma study, I choose KPJ UC is due to KPJ UC have a higher chances of job as I graduate.
I would like to have a special mention on our Bachelor of Pharmacy. This program has been accredited by the Pharmacy Board of Malaysia in 2017. Meaning that our graduates are pharmacists that are recognized by the Pharmacy Board professionally. And what is unique about our program is that upon graduations, they will automatically be employed by KPJ hospitals to work as housemanship.
I finished my foundation in science, I decided to pursue my undergrad studies in corporate communication as this institution teaches me to always seek for knowledge.
Our main groundbreaking achievement that has made history, not only at KPJUC, but history in Malaysia, is our success in conducting the Masters of Medical Specialist program.
The KPJ UC has actually helped me so much, given us support and also contributing to helping us to improve and success in becoming a ENT surgeon.
The reason why I joined here is to become the best radiographer and to deliver high quality in KPJ hospitals and institutions.
We are happy to note that we have a new additional college that's joining the KPJ Healthcare Group. That is the Malaysian College of Hospitality and Management, or in short MCHM. This allows KPJ Education Group a wider range of courses to be offered other than healthcare, because they are focused on hospitality and management courses.
Selepas 2 tahun setengah saya bekerja di Hospital KPJ Pasir Gudang, saya telah membuat keputusan sendiri. Saya membuka syarikat yang menggunakan base sebagai home physiotherapy service, di mana itu lagi mudahkan orang lain lah. Dan sekarang ni saya mempunyai physiotherapy center sendiri yang bernama Prescreening Health and Welfare.
When I reflect back through my career path, I never dreamed to be where I am here now today, to become the CEO of KPJ Rawang Specialist Hospital. Now, more than 20 years has gone, and I'm still with KPJ because I feel that KPJ have made my dream come true.
Assalamualaikum warahmatullahi wabarakatuh. Very good morning. Boleh dengar ke speaker semua suara saya? Boleh. Okay, marilah kita onkan video.
Boleh on
So at the moment we have 42 participants live. So are we going to wait for another minute or we can just start the session? I think we better straight away start the session without any delay lah kan?
Yeah, already 10.
Yeah, already participants pun dah almost 45 participants, is quite a good number, so we proceed lah. Okay, so first of all, thank you to all the viewers, participants, and most probably the first and foremost for our honorable speakers for today's webinar session. So welcome to our Research Management Center KPJUC webinar session. This live forum serves as a platform to discuss issues related to COVID-19 pandemic that impacted people life today. So I am Norhayati. Muhammad Zain will be the moderator for today's webinar, insyaAllah. The discussion is expected to assist and guide researchers and scholars from various disciplines to spark for research ideas and strengthen the proposals writing, hence to produce best quality proposals. For everybody's information, this forum will cover issues and potential research and innovation projects in healthcare setting, engineering technology, information system, and mental health among patients and public. So as we all know, this COVID-19 pandemic poses an unprecedented global challenge, impacting profoundly on health and well-being, daily life and the economy around the world. And this pandemic is disrupting universities and research institutes across the world. But the same institutions are also working very hard to find out how the disease can be stopped and its effects mitigated. This pandemic has strained the healthcare system not only in Malaysia but worldwide. Another challenge that is around the corner is how will healthcare models evolve once lockdown is lifted. There is no way hospitals can go back to functioning how they used to. A lot of changes will have to happen on the administrative and physical level to adapt to the paradigm shift that this pandemic has created. So to discuss further on this, we have our first panel, Associate Professor Dr. Aini. She is the Postgraduate Coordinator and Senior Lecturer from School of Nursing KPJUC. So Dr. Aini, how are you today?
Alhamdulillah. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan selamat pagi kepada semua panelis dan juga kepada semua peserta yang mengikuti webinar kita pagi ini. Thank you Dr. Yati.
So we just straight to the point. I would like to ask your point of view. How the healthcare industry is preparing for post-COVID-19 lockdown era, and what are the important subjects or areas of research that related that maybe we may look into in future. So please share your ideas Dr. Aini.
Terima kasih Dr. AP Dr. Norhayati. Well, actually, I think what we should see right now, what are some of the impact to healthcare organization, So in my slide, definitely I'm going to share with all of you how does this COVID-19 give an impact. This is just like what happened previously when SARS or when MERS-CoV affected some of the countries. Because I think COVID-19 is tremendously very terrifying infectious diseases. So let me just start with my presentation. These are my content outline. Before I focus on what are some of innovation in research in nursing that need to be done, but let us have a look and get some understanding, because I'm sure some of the participants this morning are our students, So Alhamdulillah, with what happened in our country, this is what happened in China. I think I've been following this COVID-19, because it began in Wuhan, and that's why I think until the US president said that this COVID-19 is a Wuhan disease, Okay, what happened that this, as you mentioned earlier, Dr. Prof. Norhayati, that COVID-19 is rapidly spreading worldwide. I think up to now, I think there are about 2 million confirmed cases, and there are about almost 200,000, I think the latest death, reported. And in fact, in China, where they started, I think that was very terrifying, because there are almost 100,000 over cases, confirmed cases, Okay, this is what happened, initially that in the clinic, they have so many cases came with having fever, respiratory, and infectious diseases. Yeah. So this is how then the epidemic progress. Yeah. And then they have to send, I think, few thousand of nurses from over China to Wuhan and to what is another district to Hubei. Yeah. So let me just give you an overview about Malaysia healthcare organization. We know we have 14 states, we have 2 territories, and Malaysian healthcare system is being managed by Ministry of Health, and also we have both. 2 tier, that is tertiary and primary. Yeah, and when we define healthcare organization is the institution and resources that deliver healthcare services to meet health needs of target population, especially when we say about target population are from womb to tombs, that means from those perinatal stage to a dying stage. Yeah. So we have a very good, alhamdulillah, a good healthcare organization. They are very efficient, widespread system of healthcare. Yeah, and it is under Ministry of Health. And the latest Minister of Health, Datuk Sri Dr. Adham Baba. Yeah, and we have several hospitals, and these are some of the government hospital that they identified as COVID hospital, and private hospital like KPJUC, yeah, and teaching hospital like Pusat Perubatan Universiti Malaya. Yeah, and we do have under the Ministry of Health clinics, yeah, and this is also they play an important role, especially at the district area, yeah. And we do have also our MCH clinic, and definitely they are ongoing to serve the maternal and child health services. Okay, and you mentioned about the pandemic. So this is what happened when we call pandemics, outbreak of disease that become widespread by the transmission of human infection. And we have heard several disease outbreak before, such as Spanish flu, Hong Kong flu, SARS, Ebola, Zika, and many more. Yeah. And what the main feature of pandemic is actually it spread across the broad geographic area, and the disease movement can be very rapid, and there is novelty intensity, high attack rates, explosivity, and limited population immunity, infectiousness, and contagiousness. And pandemic always adversely affected the health of the global population. And this will, as I said, the impact will destabilize the world economies, the social infrastructures, and both geopolitical and natural environment. Yeah. And the report emphasized that the current pandemic outbreak of COVID-19 has great impact on various stakeholders. And what is happening, currently worldwide is the challenges to global economy. So I'm not an expert in economy, so I would not touch on that. But what is important now is more on healthcare organization. Yeah, we have not yet lifted the lockdown. So this is where I think other allied health professionals, they are more looking into the needs for development of therapeutics and vaccine. And up till now, as far as I think all of you know, that we are concerned that there are no vaccine yet. Yeah. So we still have not won the battle, and maybe we have won the battle. This is what Dato' KP of Ministry of Health mentioned, but we have not won the war. Yeah. Okay. All right. These are some of the several impact to healthcare organization. Yeah. So this is where I think we are much more concerned, about the future market implication, planning for economic recovery, the need to reinvent. What happened during the COVID pandemic, what happened in Malaysia, I think the government has spent RM 500 million more for allocation to purchase ventilators and to hire, healthcare personnel, especially nurses, and also for ICU equipment, and to open up the what should I say, the quarantine area. That's cost money. I think Alhamdulillah that the government has allocated that a much amount of money so that all this can be done. And I'm sure all of us have listened to everyday updates on what is or how Ministry of Health of Malaysia managing COVID-19. Yeah. So I could say that definitely, as I mentioned here, the insight into key scientific breakthrough and development is more on ongoing clinical trials for COVID-19 vaccine. Yeah, and all the regulatory dynamics that is important. Yeah, so yeah, I will definitely speak. I will definitely explain more on nursing later on. So this is the issue actually. Yeah, restricts access to healthcare, but alhamdulillah, this does not really happen. I think the Ministry of Health is fast in identifying the COVID hospital on how to channel the hospital and especially the nursing nurse leaders. Recently, I attended the webinar by the Asian nursing leaders. How do they manage, because of this such demand of healthcare personnel? And I think there's one country, I think China, they don't have a problem with healthcare professional. I mean nurses, yeah. And Malaysia, I think they hire about 3,000 more new nurses who are retired or who have retired early retirement or who are currently not working. They are back from Saudi Arabia and from other overseas, yeah. But we are concerned about the moral distress of healthcare providers that they are facing right now. So, and I've browsed through some of the research from America, from Thailand, China. They are more looking into research in policy response in terms of how institutional preparedness in helping the institution better to meet the demands of the pandemic of COVID-19. Yeah. So this is, as I mentioned earlier, I've read a few of the research done by local as well. In Malaysia, yeah. But however, I think it's the same thing as what they experience in China in the early stage. I think our nurses and our physicians also, all of them are also have not have the infectious disease expertise. Yeah, and this is very important because COVID-19 been sudden, yeah. So no studies on the experiences of combating COVID-19 have been published. For nurses. So it's timely. I think even China feel it that it's important to describe experiences of these healthcare providers in early stages of outbreak. I think this is something that we in Malaysia also should look into. Yeah. And okay, this is the impact actually that is being published, that that healthcare providers are vital resources, and definitely nurses and doctors are the frontliners beside other healthcare allied healthcare professionals, and they work under extraordinary stress related to high risk of infection, stigmatization, understaffing, and uncertainty. I think even the Singapore healthcare organization, they face understaffing, and those who are Malaysian that works in Singapore, they have to be, they have to work. Yeah, they have to work, and they cannot apply leave. And apparently, another sharing from one of the nurse manager, or the CEO of one of the hospital in Singapore, that even during the COVID-19, there are registered nurses that who resign, maybe because of the fear of the COVID-19. Yeah, so they face many mental health problems. They are in fact have greater risk to mental health problems such as anxiety, depression, insomnia, and stress. Okay. Okay. So actually, what they are facing, I would like to focus now to the healthcare provider. Yeah, especially the registered nurses. They had no infectious disease expertise, especially in the hospital. because hospital is meant for acute cases. And another thing that once this COVID-19 acute case admitted, they are required to be nursed in ICU. And this is something that not also 100% of ICU nurses that work in ICU has specialty in ICU nursing or critical care nursing. So what happened, I came to know that the ongoing nursing education on ICU, how to take care of patient on ventilator is conducted by the by the nurse educator that who are specialized. Yeah. So this is happened in hospital Sungai Buloh, hospital Kuala Lumpur, and I'm glad that I have quite a number of my ex-students that works in the public hospital, and I in fact regularly ask them, or I would just like to know what are some of the difficulties and the problems that they face. So that is why the research in America, they are trying, even though now the country, I mean US is quite havoc with all these lot of social issues over there, and so they feel that the nurses, I mean, especially, it is necessary to gain insight into the lived experience of these registered nurses taking care of COVID-19 patients. I think similarly, this is what we need in Malaysia. This is, I said, we should do more qualitative study on understanding how is their experience, the stresses that they undergone. I know the barrier is, coming up for focus group discussion or for one-to-one interview is quite a challenge now with all these social distancing, but there are always ways how we should do that. Maybe it can be a narrative qualitative study can be done. So it's important, the frontliners, and every day we see this about key person, and nurses, midwife, all health workers are on the COVID-19 front line. And and I did browse some of the COVID-19 about the qualitative studies that they have been done, that has been done. Yeah, that frontliner healthcare providers treating patients with COVID-19. So I think there are many studies on looking into the psychological or the mental health of the nurses. And but no one, I think, has looked into this, the expertise on the infectious diseases expertise, and no qualitative study as such. Even I browsed the Cochrane, yeah. So Cochrane did suggest that timely, that we need to do a study that support them effectively, and it is necessary to gain insight into their experience in nursing patients with COVID-19. Okay, this is something WHO and nursing research, and they acknowledge that nursing research has to be paramount in dealing with the emerging coronavirus pandemic. Okay, now let me move on impact on nursing practice. When we talk about nursing practice, it's always we relate to education, clinical service, clinical nursing, as well as research. So, we have to move on in, to do more research and to support our nurses in Malaysia, because nursing practice, especially they are saving life in the pandemic, and wide-ranging nursing research plays a critical role. So the way to move forward is only through nursing research. And being I myself as a chairman of Research Interest Group of Malaysian Nurses Association, so we have been discussing this through the WhatsApp group of RIG, Research Interest Group, that we are going into, looking into to understand the experience of nurses practice, in under-resourced hospital. I think Malaysia tak adalah yang masalah yang kekurangan peralatan. And every day we heard that they only have about, I think we have about 100 over ventilators, and there are also a standby hospital with ventilators that can manage patients who need or who require ventilatory support. However, we should look into, more of their social and personal and psychological impact of COVID-19, especially those nurses who are being quarantined. I know that there are no study yet in Malaysia, looking into how do they feel they themselves being quarantined, they themselves being separated by their families, and by especially so, they are being separated from their children. I think every evening I will receive some of the iconic that the tearful faces, yeah, that they have not met their children for past 3 months, yeah, and they have not gone to see their families, their parents at home, and they have to work 12 hours a day. That could be very challenging. That could be very tiring for them. There are certain like PPUM. This is what I heard from the chief nurse officer. They have started the 4 hours shift, so they're being rotated in view of the PPE. Because PPE can be costly, and I think for 4 hours they still can tahan lah their bladder, so that they do not have to take out the PPE. So they have good enough rotation, but unlikely in Singapore, they still have to continue with their 12 hours service. Yeah, and in Philippines, I think they are okay. They do have enough nurses as well, and even in Thailand, I think they are quite. But they are fortunate that they do not have high cases of COVID-19. And also, what is another concern about this, where nurses can do they can do research on looking into the elderly, because we are concerned that now if you were to see the prevalent rate or the incident, they are more on those elderly with chronic diseases. So that healthcare services is actually their services more looking into, they are providing services on health promotion. So it's timely that they go into health promotion. Yeah, this is another venture that in research they should look into health promotion of the elderly, giving them more awareness, knowledge, looking into their attitude, practice of COVID-19, so that we can prevent less cluster, yeah, and no more new cluster for this COVID-19. And also on disease prevention. I think this is where the effect of health education on disease prevention, whether they're aware about diagnosis and treatment, and then those who have been diagnosed with COVID-19, they have been discharged, are looking into on the rehabilitation side, the role of the nurse into the rehabilitation of this COVID-19, because the possibility of recurring of the disease is high. Okay, and more research. So this is maybe we can give that to nurse epidemiologists. Maybe we can work together. Yes, collaborative research with those medical sciences experts or the pharmacological expert. Yeah, and yeah. More research, more focus on lived experience of clinician, patient, families, and communities, as mentioned. Yeah, and okay, right. We should look into, what are some conclusion of the research that are being done. How do they manage to alleviate the situation at the front line? Yeah, so we should be looking into more research that's been done from other countries. Okay, so maybe we can coordinate with other countries, and this is where Malaysian nurses should look into. And these are some of the focus of nursing research. These are some of the research that has been done in China. They are more concentrating, looking into the nursing perspective on the impact of COVID-19, the experience of healthcare providers, knowledge, attitudes, work stress among nurses, nurse importance of in fighting COVID-19, and the nurses' preparedness. Okay, and there are more that maybe we should look into more of qualitative study, but I know the time now and the should I say the way of life now, and we should adhere when we are going to do this qualitative study. We have to adhere those SOP given by the KKM, that is like 3S, the social distancing, we have to use our, and another 3W. I'm sure all of you know about this. However, the quantitative study can be conducted through online or online survey. And I think that is not a barrier for us or obstacle for us to do more research. I mean, nursing research. We would want that, nursing research will provide answers during the crisis. I think we are still, even though it slowed down, the crisis has slowed down. There are less and less new cases, but we will not know because some predict that there will be another tsunami of COVID-19. So we pray to Allah that we would not face with this, and it's timely that healthcare organization, especially the hospital in Ministry of Malaysia, they look into more and training of future nurses, because they have reduced the number of this diploma in nursing intakes, and they are focused. Yes, definitely they have to focus more on post basic, make it mandatory or compulsory for those who is going to work in ICU or in critical areas like emergency or high dependency ward should have ICU training or emergency training. And we should be able to, we should look into solution to face the challenges that we are confronting at our healthcare system, and definitely for those nurse clinicians. And hopefully nursing research, should come up with policy, and because nursing research in policy response and institutional preparedness are key in helping institutions better meet the demands of the pandemic or any pandemic. But right now we are facing with COVID-19 pandemic. I think that's all, Prof. Dr. Norhayati, that I could share. Maybe later we can see the chat. Maybe I could answer some. But I think KPJUC, yes, I forgot, before I end. When we talk about private healthcare, there is some also impact to private healthcare organization during this COVID-19. I think that you can assess that via internet. There is a good write-up how it impacts the private hospital, those who are giving the pharmacy, that are opening pharmacy, and so on. Yes, Dr. Yati, thank you so much. I hope I'm not fast enough, and I hope for those participants who are with us today, able to understand, and you can ask questions wherever you are. Okay. And hopefully all nurses who are listening, so we should be more rigorous in doing research. We should do more research, and because I think most of us doing research during the academic life, I mean during when they are pursuing their study, and we RIG, I think hopefully we are coming out with plan to do more research as well. That's thank you very much, Dr. Associate Professor Dr. Norhayati. Thank you.
Thank you, Dr. Aini, for the very informative info sharing. And then I guess this is not only for nurses, even though the nurses is the majority of the frontliners, it is applicable, the same views goes to the others frontliners, I guess, especially the radiographers, the physiotherapists, and even the pharmacists. So I think we can at least get some ideas, the views from this profession and relate to the other profession as well. Not only focus on the one professionals on the professions, but it's good. And according to this Haji Izham, he stated that in post-COVID-19, we need to review our current services, need to be creative in offering and delivering healthcare services, strengthen home care services.
Yes,
And I
yes.
agree with Dr. Aini. I think this is something that we might look into during this, in response to this pandemic, because we can't go out and we actually looking for the service in our home, right? I think this one is a new points to explore. So thank you, Dr. Aini. So before
Welcome.
we move forward to the other speakers, for your information, the Internet of Things is a well-defined scheme of interconnected computing tactics, digital and mechanical devices possessing the capability of transmission of data over the defined network without having any human involvement at any level. All these discussed devices are associated with their particular unique identification numbers or codes. This IoT is now well established and proven technology which acts as a junction to the umpteen tactics, instantaneous analytics, philosophy of machine learning, sensory products, and etc. Moreover, Internet of Things in typical daily functioning is recognized as the utility of the products of the appliance serve the real life requirements of human beings in various means such as security system of the home, smart lighting arrangements, and many more others which is easily controllable through our daily using smart speakers and smartphones. So to elaborate more on this topic, actually we are not focusing on the healthcare. We are trying to integrate some of the engineering people in our discussion so that we can open up our mind, not only focus on this healthcare setting. So I would like to introduce our second panel is Professor Insinyur Dr. Norhayati Soen. She is the Director Center of Printable Electronics from University Malaya, and she is also the chair for Electron Device Society for Malaysian Chapters, Institute of Electrical and Electronic Engineers, IEEE. And Prof. Yati, are you here? Yeah, of course.
Yes, thank you.
So, Prof. Yati, without further ado, can you elaborate more on the growing role of IoT in COVID-19 response and potential effort on the research collaboration that involve engineers and healthcare industry? And what are the potential subject areas or research that related that we may look into it? Please welcome Dr. Yati.
Okay, thank you, AP Dr. Norhayati. So we are sharing the same name. Okay, thank you. Assalamualaikum warahmatullahi taala wabarakatuh to all panels, organizer, and the participants. So I'm Norhayati. I'm from the electrical department, University of Malaya, and currently I lead the Center of Printable Electronics. And my background is in biomedical sensor or microsensor, or in specific is nano sensor. So for my experience, for now, I'm chairing the Electron Device Society Malaysia chapter for IEEE, or Institute of Electrical and Electronic Engineers. Okay, so I believe that since all the panels, having the medical healthcare experience, I'm coming from the technical background, which associated to software and hardware part. And for this particular forum, I would like to introduce, or I would like to give some ideas how the personnel from a medical or from the healthcare industry or healthcare institutes can collaborate with the technical team. Okay, for example, engineering or all type of engineering. So what we want to focus is, first of all, we would like to see what are the applications or what are the basic of the Internet of Things in the healthcare applications and implementation. I believe that everybody already experienced in using this type of applications. Nowadays, even for the COVID-19, Dr. Aini has already given the very very strong background of the history of the COVID-19 pandemic. That is the issue of the worldwide. So how to tackle? Okay, it's not only we have to be strong enough or we have the good support from the frontliners, but in terms of technology, in terms of the electrical engineering and all sort of engineering, we must have the tools. Okay, we must have the platform. So what are the platforms? Actually, nowadays we are in the Internet of Things era, and Internet of Things era, as we understood, everything or every devices are connected. So every devices are connected. That means everything can be accessed, okay, remotely. Okay, in terms of devices, of course, we have to let the engineers to do the design on the, I believe, the collaboration between the medical sciences team and the engineering team. We will come out with the good diagnosis test, sensors, and then it can be wearable. Okay, for the wearable, of course, for the when we talk about the industry, medical devices industry, engineering, so it is a multidiscipline. So whatever engineers want to design, okay, they want to implement, we need to have the manufacturing. So that manufacturing actually where the engineers have to select the biocompatible material in order to be used for the sensor, maybe for the sensor to be implanted in human body. Okay, when we are talking about the IoT, actually, that is the applications of the internet. Okay, where everybody have to be connected, and when we are talking about the connected, it must come from the idea, the design of the software itself and the hardware itself. Okay, so these are the key merits of using IoT for fighting COVID-19 pandemic. So for this, actually, when actually IoT has already been in the system for quite long. So in terms of in industry 4.0 already, they already implemented the IoT for the telemedicine, for example. And for this, to face the IoT, using IoT for COVID-19. So some of the key merits where we can see, we can have the, for example, the effective control, you know, and then you can have the enhanced diagnosis. Okay, these are the advantages when you use the Internet of Things. Everything can be enhanced in terms of quality, in terms of accuracy, and again, it is all automated. So this is again related to the, the readiness of the nurses and the medical teams, how to use and what are the skills needed in order to, in order to operate all the high technology equipments. Okay, so these are the growing role of IoT in COVID-19 response. So I believe that for this, COVID-19, it is a highly infectious nature. So what we have discovered, and it is ongoing, it is not post COVID-19 yet. Okay, in Malaysia also, of course, the status is, I would believe that there is a fluctuations every day. But this is the growing role of the IoT in COVID-19 response in terms of, for the moving forwards research scope, where the medical teams, nurses can collaborate with the engineering teams. okay, for the biomedical equipments, okay, for the designer. For example, okay, you have the ventilator. Nowadays, people looking for the low cost ventilator where students or the research students can design with the support from the medical teams. Okay, so for this, COVID-19. So these are the basic, basic scope where IoT can contribute and already contributed, and now they are doing the enhancement of the services. For example, okay, for the track quarantine, okay, for the track quarantine group, of course, okay, we are not going to do it manually. It is very time consuming. Okay, then second, pre-screening or diagnosis, cleaning and disinfecting, innovative uses of drones, and reducing in-home interactions. So these are the five big scope. Okay, for example, for the track quarantine, I believe that even now there are few countries, they are implementing a very high technology to screen the the passengers coming out from the plane, so they can also monitor till they reach the home or the quarantine center. So in this case, when we are talking about the track quarantine, of course, we as engineers, we have to design the system, and again, we have to design so many sensors to be implanted or to be implanted as a wearable or tagging on the human. So that means when we are talking about the track quarantine, we have to enhance or we have to improve the system so that we can have the accurate data. Okay, so this is another example of the since now we have to practice the new normal, where you can have like the private proximity registration, where the engineers already designed the special sensor so that you can alert about the social distancing. So in this particular case, this is already done, and for this particular system, they keep on improving, because as long as for the receivers or for the applications to different group, they need the costing, and they need the tools they need to support in order to apply all this type of system. This is the sensing system for the social distance. So this is the example. And for the second scope is for the pre-screening or diagnosis. Of course, I believe when we are talking about the data, about this pre-screening diagnosis, they involve, we call it as a big data. So that means when the patients or when the patients come to hospital, okay, they have to do the screening, and then they have to make sure they got and they process the results, and they have to make sure what is the speed, okay, and then how accurate is that pre-screening results or diagnosis. So they need the the platform of good data analytics, okay, to process the big data. And this is where the engineering comes into the software, to design the special software where they can be used to store and to process the data and giving the quick analysis. Okay, these all are the platform of the we call it as a data management system in the hospitals or the medical related institute. So all of these needs the skills, okay, needs the good skills for the nurses and other personnel working at hospitals. So in order to do the extensive research nowadays, it is multidiscipline. Okay, the era already being changed. Okay, now is the COVID-19 era. Even before COVID-19 era, we already have the Industry 4.0 era, where everything has been, changed to the IoT. So, so in this case, I would propose, the multidiscipline research being imposed in, for example, the medical institutes, such as maybe KPJ, University College, where when the supervisors propose research topics, they might have the other supervisors who are going to look after the technical part of that project. Okay, these are the these are the design where for COVID-19 they are using the robot to do the swab test. Okay, so for the swab swab test, actually it is very dangerous to have the an open system to do the swab test. But nowadays the engineers already designed the special robot to do the swab test, and they can monitor remotely. Okay, this can avoid cross-infection for medical staff and improve the standardization of biological sample collection, ensure sample quality. So that means in terms of applications of these new robots, and these new robots have to be operated by, of course, the expert, but the expert have to be supported by the nurses. Okay, so for the third scope is the cleaning and disinfection. Okay, for this particular scope, in order for the to do these activities, robots already being designed and being used, okay, to remove the human from doing this type of activities. So in terms of, when we talk about the robots means there must be a group designing the hardware. Okay, there must be a group designing the hardware, and then select the what we call the material to design or fabricate the component, and there must be another group to do the software or programming of that robot. Okay, so that means I would like to highlight here, when we are talking about the nursing or the supports at the hospitals nowadays, what we need, in hospitals, we need to upskill. Okay, upskill is the important. To me, is a important effort. Okay, for all personnel in hospital to be reach the special readiness in order to use all these highly sophisticated tools. Okay, let's the engineers do the design. Okay, and the design, when they want to do the design, they have to refer to the like the statistic. Okay, the result from the the complaint from the nurses, and the complaint. Okay, what caused if there is no robots doing the cleaning, disinfection during the COVID-19. So I believe that the infected cases will be increased. Okay, then the fourth scope is on innovative of users of drones. Okay, for the users of drones, of course, sometimes people will say that, okay, drones is that is the engineer's part. Yes, of course, this is the engineer's part, where we have to design the motor, we have to design the special camera, we have to design the camera with the thermal properties. We want to check the temperature remotely. Okay, so for these innovative uses of drones, how do nurses or other personnel from medical side can contribute? So when we design the project, when we design the, when we want to apply for the grant, okay, nowadays we have to upskill our research scope. It's not only nurses will focus on only the scope of the nursing. And then maybe for the physiotherapy, focus on the physiotherapy. Okay, now it is a multidisciplines where everybody has to use the technology. Okay, for example, for these drones, I believe in Malaysia also people already observe that we already use this to monitor and enforce the stay-at-home orders in few countries, and then to disinfect the highly contaminated hotspot. Okay, in Korea, they also, they have the special drone to bring all the things and they can do the spraying. And even there is a special, design where they can fly the medical samples and quarantine materials. Okay, so they want to reduce the interaction between the samples and the human. And finally, you can have the drones where they can check the temperature, of those in quarantine through infrared thermometers. So they don't have to use the very manual thermometers to check one by one. So they can do it remotely and they can process the data in real time where hospitals can get the data immediately. So in keeping of this, you can see that whatever that new technologies is not coming from engineers, but how nurses or other personnel in hospital can contribute. They have to upskill the learning or the skills of the data documentation. Okay, data documentation, big data, how to analyze the data so that they can do the data processing. Okay, so for the final scope is on reducing in-home infections. This meant for the IoT, where we apply the IoT, or we can call it as, for example, if IoT nowadays we use in telemedicine, where when you want to do the COVID-19 screening, okay, it can be a practice where people don't have to go out. Okay, they can do it remotely. Okay, in the system of a smart home, everything will be connected where you don't have to touch. Okay, you can reduce the activity of touching the surface, but everything can be done using your handphone. So when you want to do that, of course, you need the special hardware, you need the special software where we have to upskill that to the minimal level that like nurses, physiotherapy or doctor can apply to their systems. Okay, so for the conclusions, I believe that actually when we talk about the moving forward for the research, okay, this is what to support the first panel, Dr. Aini. So of course, we must have a very good nurse, okay, in terms of the, in terms of their effort, right? We have to make sure that they are happy and then no stress whatsoever, but they have to be exposed to the, to the applications of the new technology. So I would believe that there must be the multidiscipline research so that nurses, physiotherapy, medical imaging have to upskill or upgrade their curriculum. So there must be the special on the technical of applications of new technology. So this is my personal view that as I'm the engineers, I'm doing the design of the biomedical sensor, and I have to study the background of the viruses, because we want to do the detection. We need the microsensor, but the background we have to communicate with. Like me, I'm in UM. We have to communicate with the doctors in PPUM. Okay, when we want to do, we have to test. There must be the samples. It must be the valid samples. So we have to communicate. So I believe that with the good, with the good combination of researchers from medical team, from physical sciences team, and engineering, okay, we can lead to a very good curriculum. Okay, curriculum where, of course, very hard for us to replace the whole thing, but it is good to have the additional, or maybe there must be the elective to support, the new how to implement the new technologies to all personnel in hospitals. This is the, I mean, it's not the short course, but in the curriculum itself, I believe that when lecturers giving projects, please make sure that the project is related to high technology, even though it's not technical, but in terms of data documentation, okay, I believe nurses need to process all the data, right? So nowadays, everything is documented virtually. All they put in cloud. But if what happened in the cloud, you cannot search. You have to let's say you have to consult the technician, engineers. If the equipments, if the equipment having problem, you have to consult the engineers, right? But can we now? We have like the adjusting of the curriculum so that our personnel for the medical team can have a very minimal skills in order to operate the equipments related to latest technology. Okay, I think that's all. Maybe I would I know that this IoT engineering and technologies is very wide, but everybody have to use it. Okay, for example, even the ventilator now they are having problem and very high cost. They open the project for low cost ventilator. So everybody, the group can join the project so that everybody, the team from medical and the team from engineering can design together the very low cost and simple ventilator that we can use at the hospitals during the COVID-19 era. Okay, with that, thank you. I hope, I've given at least some ideas how to upskill. Okay, I would say that I would like to have like a skill. Okay, nurses skills. We have so many, right? You have the imager, right? Radiologists, right? So they are not really using routine, but they have the minimal knowledge on technical.
Yeah. True. Thank you, Prof. Yati, for
Okay,
the
thank you.
very informative sharing. So, according to this Mr. Sivadev, multidisciplinary research is actually the way to do research nowadays, which is correct, and it's good suggestion. He said, it is a nowadays research must collaborate not only within one profession. So it's good that we have the engineers and the healthcare technicians to work together for better outcome. So I think this is what we can explore, especially the collaboration to study the effectiveness of the system that have been developed, right, Prof. Yati?
Yep.
So thank you again, Prof. Yati. We'll come back if we have questions from the attendants. So I think we shall move forward to
thank you.
the next panel, which is Mr. Muhammad Rizal Majid. He's a lecturer from Center of Global Professional and Social Development KPJUC. So Encik Rizal, as we all know, this COVID-19 pandemic ni kan ada the research evidence indicates that there are strong positive relationship between a healthcare team members communication skills. Ini yang penting kan, communication skills and patient's capacity to follow through with medical recommendations, self-manage, adopt preventive healthcare behaviors kan. So navigating and responding to the communication created big challenges for every company. Kan? It required speed, adaptability and creativity. Most of us need to find and learn on how to communicate using alternative way. Sekarang ni pun kita pun berseminar pun macam ni kan, tak pernah pula kita berfikir nak secara drastiknya berubah kan. So macam mana tu pada pandangan Encik Muhammad Rizal, how to communicate effectively with the public, engaging with communities, local partners and other stakeholders to help prepare and protect individuals, families and the public health during this pandemic. Ada tak apa macam potential areas that we need to look into for further research. Please, Jeza.
Okay, Bismillahirrahmanirrahim. Thank you, Dr. Yati, and thank you all the panelists, Professor Dr. Nayati, Professor Dr. Aini, and Pak Aini. So today I'd like to share with all participants how to communicate effectively during COVID-19 pandemic. How do we engage with public, community, and other stakeholders in a time of crisis? So in the beginning, many of us are unclear in how the virus is spread, the risk of infection, and the preventive measures that we can take. This is all the in the beginning. This is made worse by the amount of misinformation, disinformation, and false news, which resulted and create health anxiety and panic behavior, especially in our social networks. So here is the question of science versus perception. As we may see in the beginning, we notice a lot of news talking about vitamin C will stop from catching COVID-19, drinking water can help prevent COVID-19, and COVID-19 also does not survive in warm weather or in the sun, and many more of misinformation and disinformation. When I'm saying science, it's about scientific evidence versus perception. So as a result from this perception, we may encounter many news from the media about men dies after taking chloroquine, and in Iran itself, the worst is in Iran, over 700 dead after drinking alcohol to cure coronavirus. So this has becoming so alarming during that time, and the worst case is even everyone is taking their own life. Everyone is taking their own life, a suicidal case because of COVID-19. So again, it's about perceptions. Perceptions create problem. Perception create crisis. So we need to pay a lot of attention to perceptions, and we have to understand our public and addressing them the way they want. But it is not an effort about to change public perception overall. It's not. It is our main effort. The change to the risk perception are based on the perception itself, not the whole perception. For example, that we should change the perception. About vitamin C. Vitamin C can prevent from COVID-19. So we have to focus on the perception base. So the next is we should know the fact. Know the fact, not the fear. Know the fact, not the fear. So the problem is people are listening to perception more than the fact. Risk brings fear. Fear is very strong emotion. So the more emotional people get, the less they will listen to us. If we are taking an approach of addressing any risk from scientific point of view, people will not listen to us. So the recommendation is for us to really be really empathetic, listen a lot, and do not react to strong emotions. And the most important thing that we have to be calm when we are communicating about the virus. Okay. So in this time of crisis, in public health, risk communication is a public health even during emergency outbreak. It is popularly known by public health. They are doing risk communication. Even WHO has come up with guidelines for health officers to do on risk communications. So the aim of risk communication is to explain in clear and simple way, to provide information so that people make informed decisions about whether a risk is acceptable or not, or whether they need to take an action to prevent or reduce the risk. So it's about bridging the gap between science and public perceptions. So next is I would like to share about some of the best practices of communication during COVID-19 crisis. This is how we should engage with public. These best practices, of course, we can have it in our own country, Malaysia. Malaysia has been widely recognized as one of the best preventive when we are doing the preventive measure of COVID-19 during COVID-19 crisis. So the first thing first is we have already our risk communication system. It's all now it's about coordinating Malaysian risk communication systems. So first thing first, we need to do is to designate a single point of contact. In Malaysia, Crisis Preparedness and Response Center is an agency who in charge for anything related to COVID-19. So there have been numerous promotion or numerous information about the number of hotline by CPRC. So we need to set up both an email address and a phone number so that people can easily contact in one single point. That is through CPRC hotline number. Okay, next is about having a spokesperson to the press. So we have been already. Can you hear me?
Yes.
Okay. So because there is a question of sound. Okay. So the next thing is about a spokesperson to the press. So as we been informed that our Prime Minister has appointed another 2 spokespersons during the crisis. So they appointed our DG from Ministry of Health and our Ministry of Defence to in charge on national security. So there are 4 things that the spokesperson need to have during their presence in the public. So first is credibility. Credibility is partly influenced by the reputation you and maybe your organization have. So credibility is important during as a spokesperson to the press. Secondly is a trust. Trust is much related to the transparent, which I will be discussing later. So trust, it could also depend on your expertise or your skills. If people don't have the trust, people will lose the trust in you if you are lying or withholding any information. And thirdly is technical information. So people need to know that you are coming with specific evidence and data to inform with the public. And last is expression of care. So people need to know that you care of them or respect them in how you present your information. We still remember that during DG press conference after he informed about how many losses from COVID-19, he put in his empathetic feeling, saying sorry for the loss to the family. So that's all. It's about also expression of care. So there are 4 important things that a spokesperson need to have: credibility, trust, technical information, and expression of care. And the next is about being transparent. About being transparent. Be forthcoming. Don't lie or spin the truth. So public health officers should acknowledge and communicate even in uncertainty, because this pandemic is very uncertain. Sometimes it is A, sometimes it is B. So people are panicked if you don't have consistent messages. Anyhow, there is also uncertainty when delivering the news. So the speaker should be calm. So it is important also that we have to be fast, frequent, and sustainable. Sustainable. Be prompt to the inquiry or the news or any questions raised by the media and the public. So first announcement frames the risk and addresses concern. So it is important for the first announcement we have to really sure of what we are addressing of the concern of public. So communication must include what is known and what is not yet to be known. So people have to know about that. So people will be very clear about this. Okay, and next is accommodative. When it comes to accommodative, there are 5 things that I identified. That is prompt, compassionate, honest, informative, interactive, and listening skill. 1, 2, 3, 4, 5, 6. Sorry, Daddy, it's a 6. So we have to be responsive, empathetic, transparent, culturally appropriate, and consistent messaging in a layman term. So everything must be in easy understanding of the message in a layman term, and it's not scientifically or bombarded with technical or jargon words. Yeah? It must be in layman term. So secondly, be prepared to communicate quickly on all forms of media, any forms of media, as well as both internally and externally. We know that internally our frontliners also having some difficulties. The communication must be prepared for both. Yeah, both sides has a different side of stories. So finally, engage consistently with dialogue and forum. So we may see this in the government has always run a show in radio, television, dialogue and forum, even in on our online sites through Zoom, Meet, and rest. So as it's saying here, I give some example of what our Prime Minister is saying. Kita ibarat sebuah keluarga. So that is where he is showing his empathetic. And our Datuk Nur Hisham Abdullah also has wrote in his Twitter saying that the first rule of leadership is to listen. So we need to listen more. Actually, we are communicating through our listening. So the biggest communication right now is we do not listen to understand. We listen to reply. So another point is, I will go through another point. So it's about communication campaign. So it is to educate, to inform, and to warn the public. So that's the mission. And also using communication to drive behavior change. There are a lot of posters appears during COVID-19, not only from Malaysia, all over the world. Some are very interesting, some are very direct to the point, and some are very complex to understand. So some of practical tips for crafting effective communication in a crisis. First, we should apply behavioral principle to design a communication, because every one of us is not the same. Risks are not taken the same by everybody. So we have to understand that it depends on age, on education, and on experience. So a good thing to do in risk situation is to adapt to our audience, to understand the audience and make sure that we are connecting. And second is we have to keep it simple. The message should be kept simple and easy to understand. Highlight the key action, normally at top or in the middle. A precise advice, shorten the text and then shorten it again. Use images and graphics. Use images and graphics. So the next point is, it is not complementing if we are not talking about the involvement of media. So basically communication strategy is based on the integration of different channels of media, whichever is suitable, and public can gain a positive experience from the medium of communication. So if we notice that currently in Malaysia, about that there are 5 medium that often used in Malaysia and frequently used. First is online-based media. It is including messaging apps like Telegram and WhatsApp. And second, radio, television, newspaper, and of course SMS text messaging is popular during this time by MKN. I'm aware that, I'm sure that every one of us have received SMS text messaging from MKN. Okay, so the next point is we have to address uncertainty and perceptions and managing misinformation. So WHO has stressed out about the fighting of this epidemic. It's not about the epidemic alone, it's about infodemic. There are so much fake news spreads all around the world, it's faster and very dangerous. So, so government has set up a proper platform or channel to debunk myths and fake news. Implementation of systems to detect and respond to rumors and respond misinformation, and captures people's perception through feedback, online feedback. So in Malaysia, there are platforms sebenarnya.my, conducted by KKNM, and then as at 3 May, there are 251 false news. I think as up to date, there are more than 300 over fake news. And also the government has come up with guidelines. There are 6 guidelines to inform public 6 type of news that they are considering as fake news. This is not very popular among media, because they are saying because the guideline is there are some sentiment to it. This is not in favor to the media, the guidelines. So my next point is how to one of the best practice to communicate during this crisis is community engagement and empowerment. Okay, I'm choosing Upin dan Ipin because this is a free it is a free show about it runs around, if I'm not mistaken, not more than 1 minute. It's about how Upin and Ipin empower community through their animations. So this is where the government invited community engagement from NGOs, media, influencers, celebrities, business groups, and other trusted community groups. So there are a lot of us coming along the way to assist during COVID-19 pandemic. And we can see even in television, in radio, there are lots of messages, there are lots of advice from NGOs, and NGOs come down to assist community, helping a hand. So this is amazing community engagement and empowerment that has been currently happening in Malaysia. So the next thing that we heard that maybe after post-COVID, government will introducing a big capacity building for our community, for a community to take their own responsible on their health. Meaning that everyone is responsible to their own health, building capacity. So there is my point, Dr. Yati, and the audience, for the best practices during COVID-19 pandemic in communicating with the audience. So in terms of research areas in the field of communications, this is some of the things that I found it very interesting to look at. First, on health communications, political communication. We can see a lot of political communication is currently having a lot of communication related to COVID-19. Public health communication, social media studies, crisis communication, communication ethics, risk and crisis communication, public health data visualization, visual communications. I give you some example how we can venture into research. Because currently government use communication campaign to try to change behavior, right? So communication campaign by the government can be tested through its effectiveness. We may look at the level of awareness, understanding, and behavioral indicators of public. And some sentiment question can be asked, like how do you like our government is currently doing curbing the COVID-19 pandemic. So those are some of the examples of what research that we can look at. And of course, there are some issues on media and ethics, the freedom of speech, press freedom. So that's all the things that we may look into. And also comparative study with other countries, and there are lots more coming for research area in the field of communication. So so that's it, Dr. Yati, that I can share with the rest. Terima kasih.
Yeah, terima kasih Encik Rizal. Thank you so much. Very interesting and very good sharing lah. I can say that because it's not mainly for healthcare
Yes,
personnel,
yes.
but we can generalize it lah. It's
Yeah.
what I can say. This platform is not actually to focus on the one professions or professionals. It's
Yes,
actually
yes.
integrated. The community, the frontliners, the researchers. So it's good. It's good for us to explore on this communication because nowadays communication style is totally different, right? So thank you, Encik Rizal. So I think this
Okay.
topic is um, got a continuation to the next speaker, which is Encik Rizal has mentioned about this communication, the importance of communication and the social creature. We need to connect, communicate and interact. However, due to this pandemic, we experience deep impact on the way we perceive, like what we have been presented by Mr. Rizal just now. And directly or indirectly, it's causing stress to all of us. Am I right? So
Yes.
it's causing stress not only for the I think I mean the good the through the real information but misinformation as well. So here we need the psychologist to consult us lah. Okay, since this uncertainty has alarming implications in terms of physical and also mental health towards an individual and community. So we have here Miss Haja, Puan Siti Haja. She is currently a clinical psychologist and lecturer in KPJUC. So Miss Haja, can you elaborate more on the impact of COVID-19 pandemic to our mental health and lifestyle? And what are the important subjects or areas that we can look into for this psychology area? Please, Miss Haja.
Okay, thank you, Dr. Hayati, as our moderator today. And also all panelists, Dr. Aini, Professor Dr. Hayati, and also Encik Rizal. Okay, so for today, I will discuss two things, which are the first one is impact of COVID-19 pandemic to our mental health and also our lifestyle. And the second one, I will discuss on the important or research related to psychology in general or mental health. Okay. Okay. Pandemic like our situation right now, COVID-19 is not just a medical phenomena. It affects individuals and society on many levels and also causing disruption. So as we know, this pandemic not only cause in terms of our effect in terms of our health condition, it also affect in terms of our financial economy, our communication interaction, has been said by Mr. Rizal previously. So it inducing a considerable degree of fear, worry and concern in the population at large and also among certain group, for example, older adults, us ourselves, healthcare providers and people with underlying health conditions. And according to World Health Organization, WHO, levels of loneliness, depression, anxiety, harmful alcohol and drug use, also self-harm or suicidal behavior are also expected to rise. Before the pandemic COVID-19, we only tengok dari segi percentage yang naik itu only depression and anxiety. But after the pandemic of COVID-19, this is all depression, anxiety, alcohol and self-harm or suicidal behavior are expected to rise. Okay, and then to discuss the impact of COVID-19 pandemic to our mental health and our lifestyle, I will divide and elaborate based on two groups of people. The first one is general public, the second one is frontliner and also healthcare professional. Okay, first one is general public. Okay, general public here refer to non-frontliner in this discussion. I will focus on fully functional individuals, the first one. The second one is individual with pre-existing condition and also children. So facing this large scale infection threat, which is COVID-19, we know that people are under increased psychological pressure. Some of the issues that are frequently discussed and experienced by general public are, for example, termination of work, cutting of salary or wages, limited communication, fake news has been said by Mr. Rizal, adapted with new norms, and also many more. So this uncertainty and insecurity cause various mental health issues such as fear, anxiety, grief, and also depression. So this fear and anxiety are compounded by social distancing and limited communication. This force an individual to stay at home, like us, for an extensive period. As we know, as an individual, we need and we want to be connected and interact with other people. Yet, we don't want to be infected by this COVID-19 virus. This could be disrupt the social rhythm by depriving one's regular coping mechanism with stress and hence putting our mental health at stake. For example, previously we were able to hang out with our friends, watching movie, eating outside, shopping, and for example, we play football, futsal, or involved in any other activities. But right now we cannot do all this regular coping mechanism, and we need to adapt with it. So for those who are unable to accept or adapt with these new norms, they find this situation quite stressful lah. And if we are not managing it in a right way, I think it may cause serious issue like depression or any other types of anxiety. And next, we move to individual with pre-existing condition. Individual with pre-existing condition here means individual with before the pandemic COVID-19 already have been diagnosed, for example, with depression, anxiety, OCD, PTSD, for example. Okay, and pandemic may also negatively impact the vulnerable population and especially patients with serious mental illness. For people with pre-existing mental illness suffer a greater risk of relapse and they also experience fear, anxiety and also social rhythm disruption. It's the same one. As example, I will give two example, people with individual with pre-existing condition. First one, individual with pre-existing conditions such as post-traumatic stress disorder, PTSD, and also OCD, obsessive compulsive disorder. Okay, for patients who suffer from PTSD due to past family trauma, for example, there has been physical abuse or social abuse at home, staying with the family during this quarantine with more contact at home during this MCO could mean disaster for them. And this can be seen, we can be seen this from the Women's Aid Organization Italian Case report. They found an increment of 44% and 57% respectively in contact after the government issued MCO, for which domestic abuse is one of the reason, which is physical abuse and social abuse. Okay, and for those having pre-existing conditions such as OCD, the second one, as I said previously, this group of people who have contamination of OCD potentially already suffers from the compulsion of frequently and repeating washing their hands. So this COVID-19 pandemic then creates a blurry line between safety as we do right now, kita basuh tangan, kita jaga kebersihan, all that, and between this safety and also compulsion is related to their obsessive thoughts where most patients with OCD experience. Okay, and then the last group have an impact towards this pandemic COVID-19 with children. Even though children, we know that children have been reported to be less susceptible to COVID-19 infection, we have witnessed considerable psychological implication on them. The shutting down school, they cannot meet their friends, cannot meet their teachers, and also cannot go to playgrounds, and the restriction of outdoor activities alongside we as a parent ataupun their parents, fears of contaminations, all these have been triggered manifestation of anxiety, panic attacks, also psychosomatic symptoms. Okay, I think so. There are three groups under general public, which are fully function individual with pre-existing conditions, and also children. So all these three groups, we can see were affected directly to the COVID-19 pandemic, and we can see some of them also experience psychological pressure. Okay, so let's move to. Okay. Okay, let's move to psychological impact on healthcare professionals. Okay, so healthcare professionals, beside the general population, like general public, I discussed before this, healthcare workers on the front line also at risk of developing psychological distress while managing patients with COVID-19. The frontliner experience a lot of challenges that have not been faced before. So this is some of the challenges. Decisions have to be made fast, ranging from efficiently triaging and isolating patients with suspicion of infection to deciding whether to shut down department and operating theatres when a patient ataupun staff have been test positive. limited resources, dealing with uncooperative patients, the use of protective equipment for long periods of time yang PPE diorang guna tu kan. And then that caused difficulties in breathing and limited access to toilet and water, also resulting in subsequent physical and mental fatigue for the frontliner. Okay. In addition, due to the increased risk of exposure to the virus, our frontliner doctors, nurses, and also healthcare workers fear that they may contact with the COVID-19 themselves, and they worry about bringing the virus home and passing it on to the loved one. For example, our family members, elderly parents, newborns, also relatives. Okay. Therefore, we can see that healthcare professionals dealing with COVID-19 also experience psychological pressure and experience high rates of psychiatric morbidity. All the issue I stated earlier has provoked overflowing anxiety and depressions among healthcare professionals. So I think both the general public and also healthcare professionals have impact towards their mental health due to this COVID-19. Thus, to curb and counter this situation, we really need to know what is our personal effective coping strategy. And by knowing and practice it with the support from our family and friends, inshallah, I think we can together go through this pandemic positively. Okay. And then let's discuss on the psychology related research. Okay, so before I elaborate more on the important subject areas for research related to psychology and mental health, I like to emphasize on the definition of psychology itself. Psychology is the scientific study of mental processes and behavior. So anything related to mental processes, which is cognitive, memory, attention, perception, language, and many more, and it is related to our behavior, can be considered as a psychology related research or field. So psychology is not mainly on mental health only, but it is a broad field actually. We have industrial and organizational psychology. We research on the performance, also well-being of the workers. Education psychology, we study about the students, how the behavior, how the to teach, to make the teaching process effective. Child psychology, sports psychology, and many more. But for today, I will only discuss what I fluent on, which is clinical psychology that is related to mental health area. If you are interested to do research related to mental health, you can explore on first quality of life during and after COVID-19. The specific target group, the group would be general public and also frontliner. And this one, we already have fully developed questionnaire on QOL, quality of life, and it is according to WHO standards. Okay. And the second one is individual, family, and interpersonal coping strategy with the COVID-19 emergency practiced by general public and also frontliner, the target group. Coping strategy, we can explore on the emotion focus coping or problem focus coping, and we can also explore on the spiritual coping, cross-cultural coping, and many more. Okay, the third one is mental health condition for frontliner. First, people infected with COVID-19, patient under investigation (PUI), patient with pre-existing conditions. In here, we may explore types of psychological disorder that may experienced by all of these groups. For example, depressions, anxiety, OCD, traumatic, phobia towards the COVID-19. Okay, and the next one is risk factor of psychological distress at the individual, family, interpersonal, and cultural level. For this one, we can see the risk factor, for example, activity restriction, we need to be quarantined, reduction of pleasant activity, pleasant events, personality traits, hypochondria and also hypochondria, mental disorders, family characteristics, and also social support. So we can explore on all of this research. The next one is impact of mass media and social media on psychological attitudes and behavior towards the COVID-19 emergency. So this one, it focuses on social media and also mass media we currently use, for example, Facebook, Instagram, okay, towards our psychological attitude and also behavior. And the next one is clinical and health-based psychological intervention for sufferers, high-risk individuals, government, and policymakers. So for those who have pre-existing condition psychological disorder on any health condition, kita nak tengok intervention for these particular groups. Okay. The next one is behavior change intervention to improve adherence and compliance with preventive regulation and guidance. So this one, we want to make an intervention, behavior change toward individual who are unable to follow the law. Contohnya kalau kita kata kena quarantine during this time, dia pun rentas negeri ataupun dia tak ikut law have been act by the government. Okay. The next one is internet intervention, remote psychological support, mHealth, eHealth based treatment, psychology oriented digital tools and apps in the COVID-19 emergency. This one is very interesting topic because we currently don't have any mHealth atau eHealth yang related to COVID-19. Kita ada eHealth atau e-assessment atau e-intervention, tapi tak ada yang related to COVID-19 emergency. Okay. And the last one is monitoring changes in psychological, behavioral and interpersonal response to the COVID-19 emergency over time. So this one is more on the kita tengok in terms of psychological, cognitive, also behavior and also how the way they communicate and interaction with other people. Okay, so I think that's all. So you may personally discuss with me if you are interested with any of the topics, or you can discuss with my psychology team, Miss Munira, and also Madam Amal, also Madam Adila, if you are interested in any of the topic for psychology. So I think, thank you. That's it.
Yeah, thank you, Miss Haja. Very interesting input. If we look at this chat here, according to Madam Halima, even after COVID-19 pandemic, the society must take charge of their health through continuous practice of the current preventive measures, washing hands with soap and water, sneezing into our sleeve rather than spreading the droplets, which is true. And I think it's related to our acceptance level, coping strategy. Kan? So now I think instead of preparedness to the fasa-fasa pertama the COVID-19, sekarang kita must look into the coping strategy pula kan, macam mana sebab because of this new normal. So maybe this one is something to explore, new things to explore and a potential research area for the researchers to look into instead of this the other aspects lah. Okay, so siapa lagi ada dekat sini? Mr. Umar Fahmi bin Haji Murad. He asking, is it we can find out approximate duration for the COVID-19 vaccine? Macam mana tu Dr. ni? How long actually for this clinical trial untuk kita dapat the vaccine kan? Speaker Dr. ini, speaker. Dr. ini? Dr. ini, I think you have to turn on your microphone, your audio, because we can't hear you.
Hello, Assalamualaikum.
Yeah. Now you are on.
Oh, okay. Responding to that question, I think hanya Allah yang mengetahui. Walaupun I think beberapa negara utama seperti Perancis or France, ya, mereka dah mula cari dan juga di China, tapi sampai kini tak ada lagi dah kata muktamad bahawa vaksin telah dapat dihasilkan. Jadi kita bersabarlah, yang pentingnya kita lihat kepada preventive measure dulu. I think that is more important. That the 3S, avoid 3S kan, and adhere to 3W. I think tu yang disarankan hari-hari without fail by our Datuk KKM. Itulah dulu, insyaAllah vaksin akan timbul. Kita berdoa lah, because tak tahulah jawapannya. Saya search juga about the vaccine. Kalau ada vaksin pun, I think the vaccine going to be very, very expensive and very scarce lah in term of the production. Banyak clinical trial nak buat tu, cost money.
Yeah, that's true. I agree with Dr. Ain. So I think it's almost 2 hours. It actually exceeded our plan for 1 hour webinar. An interesting session, and until now we still manage to maintain the participant not to drop the webinar. So it has come to the end of this webinar. So I would like to take this opportunity to thank all the invited speakers and participants, viewers for joining us today. And it is hoped that all of us get something beneficial, at least an idea on how to go about to develop new research in response to this pandemic. So let us pray that we can overcome this situation together and embrace the new normal. So thank you to all.
Okay,
Thank you, Dr. Norhayati, for being a very good
the organizer.
facilitator, organizer.
panel.
Thank you so much. Thank you, Tunci Imran.
Thank you.
Yeah, thank you to all, especially to attendees who attended our webinar this morning. Thank you to Prof. Norhayati. I just would like to say, in nursing, actually, we really highly, if possible, the touch, high touch with high tech. So currently maybe high touch tu susah sikit lah, tapi kalau dengar PPE tu boleh lah we touch our patient. Okay, but definitely in the
Dr. Aini, at my research center, we are, I lead the Center of Printable Electronics. We are going to produce the 3D components for the PPE.
Yeah, okay. That's good. Great. Innovation. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Assalam.
Thank you.
Okay.